Good day everyone, welcome to our clinical duty, and today we're going to have a little discussion about the fluids and computation. I'm your clinical instructor, Johnny Balmeo. Let's now start. So ano ba ang agenda natin for today? So we will discuss about the parenteral fluid and the electrolyte replacement to be followed by the IV sites and the computation, and last will be the practice question. So let's start with the parenteral fluid and electrolyte replacement. What is IV fluid therapy? Well, IV fluid therapy is actually essential when clients are unable to take sufficient food and fluids orally. So ito yung binibigay po natin kapag ang pasyente natin cannot take foods orally or the fluids, or also kapag ang pasyente natin is unconscious or comatose. So nagbibigay tayo nito, the IV fluid therapy. So it is our job, guys, as a nurse to administer and maintain the therapy, and at the same time, teach our client kapag magkakaroon sila ng therapy at home if necessary, because nowadays, kapag pinalabas ka ng hospital, it is really necessary to remove the IV fluids. Tatanggalin yan. Hindi po pwedeng umuwi ka na merong nakahook. Although, pwede yan in some cases, katulad sa my father ko before, umuwi kami na merong nakahook kay Papa. So, the reason kung bakit pinayagan kami ng hospital, it is because I'm a nurse. I told them, kaya ko namang tanggalin yun. Next, let's talk about the intravenous solution. So, the IV solutions actually has, or should I say, classified into three. We have the isotonic, hypotonic, and last is hypertonic. So, when we say isotonic solutions are often used to restore vascular volume. So, kapag ang pasyente mayroong blood loss, so we can use isotonic solutions. The isotonic cannot replace the blood loss, rather, it gives a blood volume. Next is the hypertonic solution. Hypertonic solution, on the other hand, have a greater concentration of solutes than plasma. Then last, for the hypotonic solutions, they have a lesser concentration of solutes. So for us to easily understand this, let's try to check this one. Si hypertonic po, as we all know, mas marami po yung solutes niya. One of the solutes is sodium. And as we all know, sodium attracts water. So, kung hypertonic ibibigay natin kay pasyente, sa may patient natin, what do you think might gonna happen doon sa may cell niya? Let's try to look at this picture here. Sa hypertonic, as you can see, those red dots, those are sodium chloride or salt. Then the blue one are water. So, since mas marami ang solute kaysa rin sa may water, ano pwede mangyari? Salt attracts water. So, yung water nandun sa may loob ng cell, lumabas. So, ano nangyari kay cell? Plasmolysis. Pumayat or nagkaroon ng shrink. Nag-shrink po siya. Now, how about kay hypotonic? Hypotonic goes into the cells and sticks there. Paano yun? Let's try to look at this picture. Si hypotonic naman dito, katulad ng sinabi ko sa inyo kanina, mas kokonte yung solutes kumpara sa may water. So in that case, si solute will go inside the cell and it will attract water. So ano nangyari? Cystolysis or lumobo. Nag-swell yung cell. Now, last one is the isotonic. So sa isotonic, as I've told you kanina, it expands blood volume only and stays where you put it. Ano nangyari ron? Bakit walang nangyari? Nag-expand lang yung plasma. It is because isotonic is normal. Meaning, normal ang solute, walang magiging problema. Walang mangyayari. As you can see in the picture, sabi niya, it's awesome. Now, here are some examples para mas madali po natin maintindihan. For the isotonic, merong mga suwero na ginagamit natin, such as 0.9 sodium chloride, the lactated linear solution or the plain LRS. We also have the 5% dextrose in water or the D5 water. What else? I have here an isotonic too. This one is the plain NSS. Don't forget about the color because we're going to discuss that later. For the hypotonic solution naman, we have 0.45 sodium chloride and also 0.33 sodium chloride. For the hypertonic solution, we have here 5% dextrose in the normal saline. we have 5% dextrose in 0.45 sodium chloride and 5% dextrose in lactated linear solution. Or the D5NSS, then the D5LRS. Kung papansin ninyo, yung hypertonic, it starts with 5% dextrose or the D5. Mas madali ninyo matatandaan na kapag ka nag-start ang IVF or the IV fluid with the D5, hypertonic siya. Pero syempre, there's always a, what do you call this one? Exception to the rule. Because as you can see here, sa may isotonic, we have here D5 water. So D5 siya, pero it's not considered as hypertonic, rather isotonic. So huwag kayo ma-confuse ha. For hypotonic naman, yan, 0.45 or below 5% are considered as hypotonic. So comments and nursing implications for isotonic solutions such as the plain NSS and lactated linear solution, they remain in the vascular compartment. Katulad nga sabi ko sa inyo kanina, once na in-insert mo siya, once na pumasok, it remains in the plasma. Kaya hypotonic naman, hypotonic solution are used to provide free water and treat cellular dehydration. Let's try to look at this picture. Kapag ang pasyente natin nagkaroon ng dehydration, anong pwede mangyari doon sa may cell nila? Siyempre, pwedeng mag-shrink. Bakit? Mawawala yung fluids eh. So, anong maganda para maibalik natin yung fluids? Ano sa tatlo na to? Hypertonic, hypotonic, or isotonic? What do you think is the best one? It is hypotonic. Bakit hypotonic? As you can see, ang ginagawa ng hypotonic solution is ipinapasok niya yung solute at sumasama yung tubig. So, yung nag-shrink na cell, babalik po sa may normal. Although there are some cases, or should I say most of the cases, ang ginagamit po ng mga doctor is isotonic. So, it depends pa rin sa may order ni doc. Pero most of the time, guys, kapag dehydration, we use hypotonic solution. Then, for the hypertonic solution naman, it draw fluid out of the intracellular and interstitial compartment into the vascular compartment. A good example for this one is the cerebral edema. So, kapag may cerebral edema, tumataas po ang ICP. So, paano natin papababain yung ICP? Let's give hypertonic solution. Ano ba ginagawa ni hypertonic solution? Let's go back to this picture again. Inilalabas ng hypertonic solution yung mga fluids inside the cell. So kung meron tayong cerebral edema, namamaga, tatanggalin po ni hypertonic solution yung mga excess na water. Nang sa ganun, mailabas mo, maiihi. Now, let's move on to the color coding of the IV fluids. So, pakitandaan lang itong mga color coding na ito, no? Kasi napaka-importante na ito. So, for the IV fluids, let's start with the D5LRS or the 5% dextrose in linear solution. It is color pink. What else? We have the D5NM. The color is orange. For the D5NSS, that is color yellow. For the D5NR, light green. For the D5 water, that is red. For the D5IMB, that is violet. Then for the D5 0.3 sodium chloride, that is light blue. Then for the plain NSS, that is dark green. Itong pinakita ko sa inyo kanina. Yeah, as you can see, the color here is dark green. This is plain NSS. Then last, we have the plain LRS, that is blue or dark blue. Marami pa pong IV fluids. So, wag niyong limitahan kung ano yung nakikita niyo rito. Do not limit yourself because there are also other IV fluids out there. Ito lang yung pinaka-basic. Ito yung pinaka-basic na makikita niyo in a hospital. Next, ito. Ito yung mga example ng mga color coding when it comes in the IV fluids. So, as you can see here, we have sky blue. Here, we have red. Dark green, we have red. We have here, dark blue. Yeah. So, those color has code. So, coding po tayo para hindi tayo malito. Pero huwag din kayo ma-confuse because in some other hospitals, they use an IV fluids na medyo kakaiba. So, you need to be careful. Kailangan basahin nyo rin. Pero most of the hospitals naman color-coded yung ginagamit nila ng mga swero. Here's another example. But this time, it is glass IV fluids. So, nakalagay po siya sa may bote. So, there's a rationale bakit nakalagay siya sa bote instead na sa may plastic. So as you can see here, we have the dark blue, which is the plain LRS. Here, we have pink, which is the D5 LRS. We have the dark green, which is the plain NSS, and so on. Now, let's talk about the Venipuncture site. So, saan ba tayo pwedeng kumuha ng dugo at saan tayo pwedeng mag-cannula? So, these are the sites being chosen for the venipuncture. Well, it varies when it comes to the client's age, length of time, the infusion to run, and the type of the solution that you're going to use. And of course, the condition of the veins. So here, for the hands, we have the basilic. So si basilic is here. What else? We have the cephalic. Si cephalic, dito siya. We have the metacarpal or the dorsal metacarpal veins nandito. So para hindi kayo malito guys, kuha tayo ng konting tip. Si cephalic, letter C. Sang vein yan? Dito. How about this? B. Basilic. San siya? Dito. How about this one? Letter M. The dorsal metacarpal. So, yun yung tatlo na very common pagdating dun sa may hands natin kung saan nilalagyan po ng IV fluids or nagkakaroon tayo ng cannula. We can also use the dorsal venous network, although hindi siya ganun kadalas ginagamit for a reason na malapit siya dito sa may wrist natin. So, kung hindi ka maglalagay dito ng splint, delikado yun. Next, for adults, veins in the arms are commonly used. So, yung lola ko before, nung nahirapan akong tusukan dito kasi namamagana, nagkaroon ng phlebitis. So, ang ginawa ko, nag-insert ako or nag-cannula ako dito sa kanya. Dito, ang tawag dito, the median cubital vein. Diyan ako nagpasok. What else? Saan pa tayo pwede magpasok? We have the radial vein, located here. We have the accessory cephalic vein. We have the cephalic vein, medial antebrachial vein. We can also use the basilic vein here, and then the cephalic vein. It depends on the situation, pero pinaka-common na makikita ninyo kasi dyan in the hospital is the basilic, the cephalic, and then the metacarpal. Dito. Andiyan yung pinaka-common. Bakit? Kasi malalaki yung mga veins dito, so very accessible kapag nag-cannula tayo. Next, general tips for easier IV starts. So, kung mag-start ka na ng IV, these are the tips. Although, as a preclinicals, hindi pa kayo allowed, of course. Mga RN lang ina-allow nila na mag-cannula. Pero sa may return demonstration natin, soon, yes, tuturuan namin kayo. So, you have to review the medical history of your client, especially kapag ang client mo is hemiplegia. Meron po siyang hemiplegia. So, kung ang pasyente mo is hemiplegia, paralyzed siya sa may one side, for example, left. So, saan ka maglalagay ng IV fluid? Of course, sa may dominant na, dun sa may right. What else? You can dilate the vein. Well, there are different ways. First one is, dangle the client's arm over the side of the bed to encourage dependent vein filling. So, ibaba mo ng konti yung kamay ng pasyente mo dun sa may bed. Kung nakahiga siya, ibaba mo ng konti. So, pulling of the gravity. Makakatulong po yun. What else? Ask the client to open and close his or her fist. Bakit? Exercise can promote dilation of veins. Third one is, stroke the vein downward or lightly tap the vein. So, ito rin yung ginagawa ko. Okay? Himasin mo pababa. Or yung iba naman, tinatap nila. Bakit? Pinapagalit. Sa ganon, magkaroon ng vasodilation. Last one is, apply warm compress to the site for 10 minutes. Because warm or hot can cause vasodilation. Familiar naman tayo dyan. Next, make sure that the client is positioned comfortably and has been medicated for pain if appropriate. Ngayon, kung ang pasyente mo naman is anxious, hindi mahirap kuhanan yun ng ugat. Mahirap lagyan yun ng IV. What else? Because of the risk of nerve injuries, as well as discomfort in the restriction of movement, hand vein should be at last choice. So, kung ang pasyente naman natin kaya namang lumunon, doon na lang natin padaanin yung medication. Pero kung wala talaga tayong choice, sige, we will start the cannulation. Next one, If the ordered IV medication is irritating, then this time, hahanap tayo ng ibang site, maliban po sa may IV. Ano po yung site na yan? Well, we can use the midline catheter. Also, it is a peripherally inserted central catheter or another type of central venous access device. So, kinoconnect po yan from veins directly to the heart. So, at least, nababypass po yung irritation dun sa may veins. What else? Use the smallest gauge catheter that will accommodate the therapy. So, as much as possible, yung maliit daw na catheter ang gamitin natin para sa may pasyente natin here. Ito yung lagi nakastock sa akin. Bakit? Average kasi yung size ng catheter nito. Next. Raise the bed or stretcher to a comfortable working height. Huwag naman yung masyadong mababa kasi ikaw mahirapan sasakit ang likod mo. Huwag yung masyadong mataas dahil mahihirapan din naman yung kamay mo. So, dapat dun lang sa may comfortable working height. Next, limit your attempts to 2. So, if you're not successful after 2 tries, then ask another nurse to try it. Next, let's talk about intravenous equipment. So, isa sa mga ginagamit ng mga nurses before, pero meron pa rin gumagamit ngayon, is the butterfly or wingtip. Okay, ano itsura po na ito? Ito. So, sino may mga gumagamit yan? Pinaka-common po na gumagamit na ito ngayon is yung mga nagugluta. Yeah. Bakit? Kasi pangmadalian lang tong butterfly. Pangmadalian lamang po siya. So, meaning to say, after mong maibigay yung gamot, tapos na. Okay, next. These are the schematic of an over-the-needle catheter. So, ito po yan. So, ano-ano ba yung mga parts? Let's try to look at this another picture para maintindihan natin mabuti. So, here we have the catheter. So, inside the catheter will be the needle. So, contrary dun sa mga belief ng mga pasyente natin, wala pong karayom na nakapasok dito. Kasi minsan natatakot sila, sinasabi nila, wag mo igalaw yan, baka matusok yung naman mo ng karayom. Pero actually, wala pong karayom doon. Ang nakapasok doon is the catheter. Yung karayom, tinanggal na po yan. So, here we have the valve. We have the catheter, hub, plus wings. Dito ina-attach natin yung micropore natin para sa ganon, mas stable yung IV natin. We have the injection port cap. Dito, pwede tayo magbigay ng gamot, pero rarely use this one. I rarely use this one. Hindi ko rin pinapadaan yung gamot. For some reasons, you can ask that in our consultation. We have the needle grip. Then, the flashback chamber. For the flashback chamber, pagka nakita mo na nagkaroon na ng red dito, that means meron ng blood. So, kapag nagkaroon na ng blood dito, it means pasok ka na doon sa may swero. Next, let's talk about the color coding. For the color coding, we have the orange, gray, green, pink, blue, and lime. For the orange, that is gauge 14. For the gray, that is gauge 16. For the green, we have 18. For the pink, gauge 20. For the blue, gauge 22. And then for the lime or yellow, that is gauge 24. Let's try to look at this one. This is an example of the cannula. Okay? So, nakikita niyo yung color? Blue. So, meaning, anong gauge siya? This one is gauge. Yun. This one is gauge 22. Tama. Okay. Ito yung common na makikita ninyo sa mga pasyente natin. Although, gumagamit din po tayo ng pink, syempre. But sometimes it depends. It depends on the situation. For example, emergency case. Kailangan itong pasyente na to bigyan ng dugo. We can use gauge 16 or 18. Ngayon, kapag ang case naman natin is pedia, mga bata, we will use the lime or yellow, which is gauge 24. Bakit? Tandaan ninyo na habang tumataas ang number, is bumababa din po ang diameter. So, pag bumaba po ang number, tataas ang diameter. So, as you can see here, ang average natin is we have 18 and 20, pero I use 22 kasi mas smooth ipasok ang gauge 22. As for me, and some other nurses will agree din naman na ginagamit madalas nila is the pink and then the blue. So, don't forget those color coding, okay? So, we already have the color coding for the IV fluids. And now we have a color coding for the cannula. Next, we have here a standard IV administration set. So this one is also known as the IV tubes. So here we have the protector cup. Here we have the spike. See spike? Ito kinoconnect. So tatanggalin mo tong cup na to, then connect. Spike. Then next, we have the dripping chamber or the drip chamber. Saan yan? Ito. Dito tayo nagbibilang ng ating patak or ng drops. Next, baba tayo. We have the IV tubes. Here, we have the secondary port. So, ano po nilalagay sa may secondary port? Diyan nilalagay yung second line. Next, we have the clamp. Ito yung niro-roll ninyo, taas or pababa. Kung gusto mong bawasan ang flow, baba. Kung gusto mong bilisan, taas. Next, we have another secondary port. Sa secondary port, you can place a second line here. Also, you can use medication here. Dito natin paparaanin yung medication. Katulad neto. Yan. So, I have here the ampules. Pwede natin gamitin or padaanin itong mga to dito sa may secondary port natin. Then, going down, we have the clamp to stop the flow of the IV and another port. So, here you can also insert or administer the medications. Then, pababa, we have the connector to the IV catheter. Let's move on. So, these are the examples of the dripping chamber here and also the spike. The spike that I told you na kinoconnect dun sa my IV fluids. Okay, next. Regulating and monitoring intravenous infusion. Let's talk about the calculation. So, to calculate the IV fluids, kasi isa ito sa mga ginagawa ninyo as a preclinicals. So, paano ba tayo mag-calculate? First, you need to get the milliliters per hour or the ml per hour. Paano natin makukuha yan? For example, we have here 1,000 ml or 1 liter. So, paano mo makukuha yung cc per hour or the ml per hour? You have to divide that dun sa order ni Doc. So, kung order ni Doc is 8 hours, you have to consume this IV fluid for 8 hours. So, ilan kaya nababawas dito every hour? So, all you have to do is divide this 1,000 ml to the cc to consume, which is 8 hours. That is now equals to 125 cc per hour. So, ang nauubos mo rito per hour is 125 cc. So, after 8 hours, ubos na yung 1 litro ng IV fluids. Next, paano po natin makukuha yung drops per minute? So, to get the drops per minute, here's the formula. So, the total infusion volume multiplied by the drop factor. Ang drop factor po natin is 20, pero depende po yan sa mga hospitals. Some other hospitals, they use 15. So, please lang, tanungin po ninyo yung mga hospital kung saan kayo magjo-duty. Because sometimes, they use 15. Some other institutions, they use 20. So, be careful. Tanungin nyo muna yung magiging CI ninyo. Now, let's divide that to the total time of infusion in minutes. Here's a good example. If the requirements are 1,000 ml in 8 hours or to consume for 8 hours, and that the drift factors or the drop factor is 20 drops per ml, the drops per minute should be, tingnan natin, 1,000 ml or 1 liter of the IV fluids. Then, 20. 20 is constant because as I have told you, this is the drop factor. Let's divide this one. 8, because to consume for 8 hours, multiply by 60 minutes. Constant po yun. So, 8 times 60, that is 480. Now, 1,000 multiplied by 20. Let's divide that to 480. That is equivalent to 41 drops per minute. As simple as that. So, just an information to you guys. For the infusion sets, the drop factor, katulad ng sabi sa inyo, for the macro set or the adult set, sa mga matatanda or adult, sa mga gumagamit ng 1,000 ml, the drop factor is 20 drops per ml. Pero, again, nakadepende po yan. Some institutions, the drop factor is 15 drops per minute. Now, for the microset and soluset, yan po yung sa mga Pedia. Ang ginagamit lamang nila dyan is the 500 ml, pero depende pa rin yan sa order ni Doc. Ang drop factor is 60 microdrops per ml. Now, for the blood transfusion set, we use 15 drops per ml. But again, it depends on the institution. So, be careful guys. Tanungin muna natin si CI, okay? Next. For the Pedia calculation, pwede pong mabago yan. Ibang-iba po ang calculation ng Pedia sa may adult. So here, as an example, 500cc, katulad ng sabi ko sa inyo kanina, for the Pedia, they use 500 instead of the 1,000 ml. So 500 multiplied by 60. Saan nakuha sa 60? Constant po yan because that is the draft factor. So that is equivalent to 30,000. Now let us divide this one to 8 because to consume for 8 hours, multiply natin by 60. 60 is the minutes. So 8 multiplied by 60, that is equivalent to 480. So divide po natin. 30,000 divided by 480. That is equivalent to 62.5 or 62 to 63 microdrops per minute. As simple as that. I want to make an emphasis dito guys. Quick tip. When IV tubing is microdrip, that is 60 microdrops per ml, the drops per minute will be the same as the ml per hour. So usually si Doc po, ang order ni Doc is to run for 60 ml per hour. So ilan yan? Ilan yan per minute? So automatically that is 60 cc per minute. But again guys, it depends on the situation. Okay? That is just a tip. But sometimes it depends. Minsan, kailangan mo talagang mag-calculate. For example, ang order ni Doc is to consume for 8 hours. Kailangan mo talagang i-calculate yun. Pero kung order ni Doc, 60 ml per hour. Well, automatically, that is 60 cc per minute. Nakuha? Tip lamang yun. So here, as you can see, this one, this is a timing label on the intravenous container. As you can see here, 1, 2, 3, 4, and so on. Yun po yung nababawas. Next, what are the factors influencing the flow rates? So, number 1 is the position of the forearm. Yung position po ng kamay. So, kung ito ay nakataas, pwedeng magbago. Sometimes, a change in the position of the client's arm decreases the flow. Slight pronation or the supination, even the extension and flexion of the forearm on a pillow can increase the flow. So, ang gagawin natin dito, we need to advise our client na huwag masyadong malikot, lalo na kung walang splint yung kanilang IV. What else? The position and patency of the tubings. Kapag may bara, yan, delikado yan, pwede magkaroon ng obstruction. Lalo na po rin sa Pedia. Most of the time, it happened to us. It really happened to us. Sa mga Pedia, minsan, nadadaganan pagka natutulog. So, kapag ganyang nadadaganan, nag-stop yung flow ng suero. So, nagkakaroon ng backflow ng dugo. If that thing happen, magkakaroon ng pagtigas noong dugo. So, mag-stop yung flow ng solution natin, ng IV. Next, the height of the infusion bottle. So, the more na mataas, the more na mas mabilis yung pasok ng IV. Bakit? Well, pulling of the gravity. You knew that, guys. What else? Possible infiltration or fluid leakage. Kapag ka po meron ng swelling or namamaga, yan, pwedeng lumalabas, di natin alam, tumatagas na pala yung IV. Or kapag ang pasyente natin nararamdaman niya, parang ang lamig. Okay? We need to be careful with that. Pagka sinabi ng pasyente natin, parang ang lamig na nung site, then baka nagkakaroon na ng infiltration. Ganoon din kapag ka namamaga. Delikado po yan. Next, let's have a practice question here. Practice question number 1. Sagutin mo ito by your own. If you want the answer, go to the consultation. Your duty is 7 to 3. 7 a.m. to 3 p.m. Now you receive your client with the 5 LRS, 1 liter at full level to run for 12 hours. TC, or to consume. Now the question here is, you have to compute how much ml is being consumed every hour. ilan kaya ang nauubos every hour sa pasyente natin kung ang order ni Doc is to run for 12 hours. Now, next is compute the drops per minute. Ilan kaya ang drops na to per minute? Gamitin ninyo yung formula na binigay ko kanina. Next, what time are you going to remove the IV fluid? Anong oras kaya ako magtatanggal ng swero? Now, for the draft factors, ang gagamitin po natin na draft factor is 20. Now, compute. Next, if you're done with the practice question number 1, let's now move on to practice question number 2. Now, your duty here is 3 p.m. to 11 p.m. You are assigned in the medical ward, and the endorsement read as follows. You receive your client with D5NSS, 1 liter at around 800 cc level to run for 8 hours. Now, the question here is, compute how much ml is being consumed every hour. Next, compute the drops per minute. Okay, yung binigay ko na formula sa inyo guys ha, don't forget that. Now, what time are you going to remove the IV fluid? Anong oras kaya ako magtatanggal ng swero? Don't forget guys ha, na-receive mo yung swero mo na 800 cc. So, be careful sa pagko-compute. Then last, practice question number 3. Your duty is 3 p.m. to 11 p.m. and now you were assigned in the Pedia ward. The doctor's order are as follows. IBF to replace with D5 0.3 sodium chloride 500 cc at 3 p.m. for 45 cc per hour. Balikan mo yung discussion natin ha. The question is, compute how much ml is being consumed every hour. Next, compute the drops per minute. Then last, what time we're going to remove the IV fluid. Now, the drop factor here is, since Pedia po ito, it is 60 microdrops per minute. Tip. For the tip, just read it guys. If you want, pwede nyo tanungin sa akin to in the consultation. Okay, for the consultation, yung link ipaprovide ko naman yan in our GC. Okay, next, another tip. This one is a cheat sheet para makatulong sa inyo. Take a picture and I assure you makakatulong po ito sa inyo. This will be the end of our discussion. Now, this is the consultation time. Please refer to our GC for the link. For more questions or you wanted to verify or clarify something, this is the perfect time. Thank you very much, guys. Stay safe. God bless.